This podcast is co-created and co-produced by the Food Allergy Institute and the 12 Company. Listeners should know that the podcast host, Lesley-Anne Stone, is not a physician nor a licensed medical professional, and the purpose of this podcast is strictly limited to storytelling. Any content shared within the podcast is not intended to be medical advice and should not be used for diagnosis or treatment purposes. All listeners are urged to consult their healthcare providers. The creators, hosts, and guests of this podcast are not liable for any decisions or actions taken by any persons who claim to rely upon the content of this podcast. Hi, I'm Lesley-Anne Stone, and this is Resilience and Hope, a food allergy podcast. Thank you so much for joining us today. We have a very special guest. Her name is Sarah Danna. Sarah is an adult patient of the Tolerance Induction Program at the Food Allergy Institute. Sarah entered the program when she was 21 years old, and she graduated when she was 24. And Sarah is here with us today to talk about what it is like to be an adult in the program. So please welcome my guest, Sarah Danna.
Thanks so much for having me.
Thank you so much for being here.
Of course. Thanks for having me.
You are fascinating to me. You are our first patient on the program where it's just you. You're not with a mom who enrolled you. You enrolled yourself in the Tolerance Induction Program. So tell us about that. How did you find out about the program and how did you decide to enroll yourself in the program?
Yeah, so I found out about the program. I was just scrolling on TikTok and I don't remember the creator, but she was responding to a comment like, why don't you do this allergy treatment? And she was just explaining that it just wasn't the best option for her. And I had never heard about food allergy treatment. So I looked it up. They had a little box to put your info in so someone could call you and tell you more about it. And I just thought, you know what, I'll put my info in and just learn more. The next day they called and I set up my first appointment with them.
Wow. So you heard about this through a TikTok? You were just scrolling on TikTok. You decided to enter your information just on the spot, instinctively, and then they called you the next day with just seeing what happened. And what did they say to you on the phone the next day that you're like, sign me up? What happened?
Yeah, they were just explaining more about the program, and it was all really interesting to me because I had never heard about anything like it. And really, the reason why I just decided to go right for it is at the time the age limit was 21 and I was 21. So I just had to start before I turned 22. So I thought, you know what, let me just start this. And if at any point I feel like it's not the right thing for me, I don't have to continue. But it's either now or never. So let's just try it and see where it goes.
And where were you in that point in time in your life? You're 21. Where were you?
I was just finishing my junior year of college.
In Los Angeles. Wow. Okay, so you do this. You sign yourself up. What did you say to your family?
Yeah, so I had told my mom about it. Same thing. She had never heard about it either. And she was really interested in the program and just wanted me to, get more info. If it felt right, go for it. And she was really supportive of it.
What were your allergies when you enrolled in the program?
Yeah, so when I launched into the program, originally my plan was to treat 14 food allergies. I reached remission for 9 of those. So it was peanut, walnut, hazelnut, chestnut, pecan, and then poppy seed, flaxseed, and buckwheat.
Okay.
And then I'm still allergic to wheat, rye, barley, oat, and dairy.
And that is also because of a different diagnosis that came about. So why don't you
Right.
tell us a bit about that?
Yeah, so during my treatment plan, Dr. R diagnosed me with...
Dr. R being Dr. Randhawa.
Yes.
Yeah.
Diagnosed me with Mast Cell Activation Syndrome, which is basically where the mast cells are overreactive and they produce an excessive amount of inflammatory chemicals that can cause a lot of allergic reaction symptoms and even anaphylaxis. So it just made my treatment plan and treatment a little bit more challenging because I had that other condition.
So let's talk about that for a second. So you are now being treated with the help of Dr. Randhawa for MCAS, and that is through TPIRC at the Food Allergy Institute?
Yes, hopefully. I start next week.
Wow.
Will be the first official appointment. I in the beginning of October, had some of like the more testing and just meeting some of the other, providers on my plan. But Monday should be like the day I find more information of what, the treatment will look like.
Well, good luck with that. Keep
Thank
us
you.
posted
Yes.
and let us know.
Mhm.
I'll be thinking of you.
Thanks.
So, at age 21, what were some events in your life that led up to this point that you said, I don't want to live like this anymore? If there's something I can do about it, I'm going to treat this. What was that for you? Because you've lived a whole life of
Right.
food allergies up to
Mhm.
the point you were in college. You're 21, you're an adult. So what were some of those things that, looking back, you said, I no longer want to live like this?
Yeah, so I had food allergies since I was a baby, so I'm very used to living with food allergies, and I have like no I truly think that if I did not go through with treatment, I would still live a really full life with food allergies, but living with food allergies is difficult, so if there was anything I could do to make that a little easier, I was going to go for it.
So talk to me about what it was like to be social, to be a young adult before the program or even in the program. What was that like with restaurants and dating and things like that?
Mhm. Yeah, I think it was definitely challenging. I think throughout my whole life, being social, like you were saying, going out with friends, going to parties, going on dates, it always had this like added challenge on top of, the normal challenges you face when you're in high school and college. So I think that's what was really exciting, the hope that one day I can go to a restaurant and order anything on the menu and not have to worry about them making a mistake in the kitchen. When I started, before I started treatment, I had, I think, three anaphylactic reactions, and I've had 2 more anaphylactic reactions since, but to really just have that no longer have that fear of having a reaction definitely excited me about the program.
And those reactions since are because of MCAS.
They had a food allergy component, but they were not to food allergy treatment. They were outside of treatment, foods, but they just happened because I hadn't graduated yet from the program.
Okay.
Mhm.
So talk to me about the program. And you enter when you're 21. Did you have roommates at the time? Where were you living?
Mhm.
What was your living situation like?
I was living alone. Funny enough, I was supposed to have roommates and then it didn't work out because of my food allergies. But
Wow.
looking back, I'm like, it was
What
nice
do you mean it
to
didn't
have.
work out because of food
Yeah,
allergies?
my college it was very difficult in the beginning to get the accommodations I needed, and they tried to really work with me. And going into my freshman year, my peanut allergy was very severe. I couldn't be around it safely, so it was really important for me to have roommates that were not going to bring peanuts into the apartment. For the other allergies, I could kind of work around them and do other things to keep me safe. And so they had reached out to 2 other people that I would share the space with. I was gonna have my own room in a two-bedroom, like, apartment.
Mm-hmm.
And then the first day I met them, within minutes of meeting them, one of them was like, "I'm gonna kill you with peanuts. I'm gonna forget and bring peanuts into the room." And
How
it was just
scary.
it was a lot, within minutes of meeting her, and we just
Yeah.
thought, like, "This is not going to be a good situation, like, let's get ahead
How'd
of
that make you
this."
feel?
I mean, throughout my life, I have always been bullied for my food
Oh my
allergies, and
gosh.
so I've kind of felt like college was supposed to be like this fresh start for me. I moved from New York to LA to kind of start fresh. So it was hard having that experience like at the very, very beginning of college, but it has only made me stronger, and also it was amazing to then my college worked with me and they got me a single apartment. So I think in the end it really did work out for the best and that I had my own space, but it definitely just wasn't what I was expecting.
I'm so sorry that happened to
Mhm.
you. And you were bullied.
Mhm.
I'm so sorry. Ugh, that pains me. I don't know how to segue to this, but I have to.
Mhm.
You're living alone in college and you enroll in the Tolerance Induction Program and you have to dose yourself every day in a very prescribed, methodical, very strict format, your allergen over time and updose and whatnot. How did you do that? And how did you feel about that?
Mhm.
Because everybody else on the show, it's been a parent talking about dosing their child. The child is with the parent. But here you're on your own.
Mhm.
So you're preparing the dosages and you're giving it to yourself and you're self-monitoring, all of that.
Mhm.
Talk to me about that.
Yeah, and I think that's really, like, the most interesting part of it, and I think a challenging part of being an adult in the program of, like, my family lives in New York, I was in LA, so I was doing this completely on my own, like you were saying, prepping, administering, monitoring, driving myself to the appointments, and so I I think it was definitely challenging in some sense, but it also made me feel, like, really empowered to be able to do this, and, I just made it work. If I was nervous dosing an allergen, I would call my mom or FaceTime a friend or, just find other ways to not feel so alone in it.
No. I wish I knew you could have called me.
Mhm. Yes.
Wow. And then talk to me about coming to the appointments. You would drive yourself
Mhm.
to Long Beach,
Mhm.
which is about an hour, 40 minutes,
Yeah.
hour drive, and you would do these appointments alone.
Mhm.
Did anyone ever come with you?
For the first year of treatment, I went to all the appointments alone. I think, growing up with food allergies, have always been told, like, I'm so responsible and I'm so self-sufficient, and
Obviously.
right, and I just felt like I couldn't ask for that support. And so it wasn't really until about halfway through treatment that I asked one of my best friends to come with me when I introduced peanut for the first time, just because I had gone anaphylactic to it before treatment. So I was, overly, you know, very anxious about it. Of course, I was anxious about the other allergens, but this one for sure. And it was like a completely different experience. It was so much fun. She's just so funny. She knows how to make me laugh, kind of take some of the anxiety away. And I thought, from now on, I think I can ask for support. So from then, either she would come to the appointments with me or my mom would fly in from New York and kind of make it a vacation and stay for like a week with me. We would do other things. We would go to the appointments. And it was definitely really helpful throughout, that last half of treatment.
It's awesome.
Hmm.
Good for you for asking for support. Good for you. Talk to me about what it was like the first time you had peanut then.
Yeah, it
I
was
mean, you knew enough to bring somebody with you
right.
and the person made it fun and turns it around, but what did it feel like to eat the peanut?
Yeah, I was really nervous. I remember the nurse had to take my blood pressure and heart rate like a few times because it was just so high, when
Oh,
they take those
wow.
pre-vitals. I was just so nervous, but I think it's empowering. Like after I ate it, it's really cool and really exciting to, in that moment I was like one day I'm going to be able to eat peanuts freely. And now after I've reached remission for it, so I can eat peanuts freely any amount, I can be around them, and I really don't have to have, that anxiety around it.
That's amazing because I think about my son, he was 3, 4, and 5, and he understood he had this allergy and we had to treat it, but he didn't have that anxiety because he was so young. So I can't imagine what it's like as an adult to have had anaphylactic reactions, to have gone through that trauma, and then to go through the program, and then to have that moment that you eat the peanut. I understand, man. I mean, I don't because I'm not in your position, but I can really empathize and feel for you. You're very brave.
Thank you. And I always say, like, even my mom, I feel like she had anxiety around it too.
Oh, no
I'm
doubt.
like, whether you're the patient with it, whether you're the mom, I mean, you every time I call my mom, it's always like, "Are you okay?" It's not like, "Hi, how are you?" It's like, "Are you having a reaction or
Ugh,
are you okay?" So I'm like, for everybody in the family too, it's that like same fear that, everyone has to deal with.
yeah,
And I think no matter if you are an older patient in TIP or a younger patient, there's gonna be those things that you have to get through.
yeah.
Mhm.
And I understand that you have met quite a few other young adults who've been through TIP,
Mhm.
right? Talk to us
Yeah,
about it.
it's been really nice. I've met a lot of patients through social media, and then I've met up with a few. I actually have plans to meet up with two more at the end of December. I think it's just really nice. Like we were mentioning before, I think it's a different experience being an adult in treatment because you have a lot more on your plate, whereas I feel like a child and a parent can kind of share those responsibilities.
Right,
So it's just nice to have someone really going through it.
right. Talk to me about dating with allergies as a teenager, as a young adult, then going into TIP. What is that like?
Hmm.
Because as a mom, that's something I worried about for my son looking down the path. I very much feared bullying. So hearing that you were bullied really upsets me, Sarah. And then I thought about dating and what that must be like. when you're a young person and going to college and things that college kids do with parties and whatnot. So what was your experience like? Shed some light on that for the moms out there who have kids with food allergies.
Yeah, I think it there were really great parts about it. There were not so great parts about it. I think I had experiences where I would mention my food allergies to a guy and they would stop talking to me or stop responding.
Ghost you?
Yes, and then I would have exact opposite where they would go above and beyond to like pick a restaurant I felt comfortable with or pick an activity that didn't revolve around food. So I just really felt and I tried to reframe it as like it's kinda like a great screening process, like, if they're not going to respect my allergy boundaries that literally keep me safe from a life-threatening reaction, they're not going to respect my boundaries in other areas of my life, so, like, they're not worth my time, and now I'm my boyfriend's amazing, he goes above and beyond to keep me safe, and he actually came to my remission appointment and allergy treatment,
Yay.
and when I was doing weekly and biweekly, like, Xolair doses in the clinic. He would come with me, clear his schedule literally every other week with me, so, you know, there is a lot of hope, and there are really amazing people that
They're good guys out
yeah,
there.
there are.
And what about in college, going to parties and things like that? I know college kids tend to do things like drink. I don't endorse this, but I'm just saying the reality of the situation. And your guard is let down. What was it like for you to go to parties? Your guard must have always been up.
Yeah, I mean, I had a really amazing friend group, and for the most part, we honestly didn't go out too much. I went to a college where it really didn't have that like party scene or social scene in that sense. It was very small. There was other colleges near us that if we wanted to go to a party, we totally could go there. I mean, I probably could count the amount of parties I went to like on one hand in all of college, but it's actually like a very I get asked this question a lot more than I would ever imagine, and it's always parents scared that their child is going to drink and accidentally eat their allergen. I can say that I have never been drunk enough to accidentally or want to eat my allergen. I've never forgotten about it ever, so that's just never something I had to worry about.
Okay, good.
Yeah.
Okay, good. All of us, mom, we do think about stuff like that. So
Yes.
thanks for clearing the air.
Yeah.
Thanks for that. Let's talk about your kitchen.
Okay.
I keep imagining your kitchen in my head. Talk to me about how you kept your treatment foods separated from your everyday foods, your safe
Mhm.
foods. And were you afraid in your own kitchen during treatment?
Yeah, that's interesting. I kept all of it in specific containers and then in one cabinet, and then I would prep all my doses on one day and do like a deep clean of my kitchen. But I think also as I went through treatment, I also started building tolerance little by little to where, I was okay with cross contact and it was fine that it was in my kitchen. So I think it was also empowering in a way too.
Was it weird?
Definitely weird. I think, like, especially avoiding food for, like, my whole life, like
Yes.
peanuts, for example. I had never even eaten a peanut before allergy treatment, and now I'm buying, like, a whole jar of peanuts. It's so odd.
It's so weird.
Yeah, and now I eat 60 peanuts a week, so it's absolutely wild to me, but it's also really cool.
It's awesome.
Mhm.
Growing up, did you go to sporting events like baseball games where there was like, did you go to Yankee Stadium or?
I did. I would go to baseball games very, very very rarely with my dad, but we would just find a way to make it work.
Wow.
Mhm.
Wow. Okay. So talk to me about treatment. You were in treatment for 3 years.
Mhm.
How many appointments in total was that?
I forget the exact amount just because my plan kept getting rewritten or it was rewritten a few times. I think there was about 10 appointments and then tolerance 1 and tolerance 2.
Okay. And how far into the process was MCAS diagnosed? Tell us more about this MCAS
Yeah, I
diagnosis.
was officially diagnosed of January of this year, so at the towards the end of my treatment.
Okay.
And honestly, it felt kind of like a relief just because I was having a lot of mild reactions that weren't really making sense based on my allergy numbers. So knowing that there was that MCAS component was nice to at least have some answers.
And is MCAS considered a rare disease?
I'm not sure actually. I know it is typically hard to diagnose, so I think I've been hearing it a lot more in the media more often, but I'm not sure if it's rare.
Okay. And okay. So you had, it was 3 years in treatment. And you're diagnosed towards the end of treatment with the MCAS, and that is because you were having reactions to dairy and to gluten products.
Hmm.
Okay. Okay. And we'll see next week
Hmm.
what your new treatment is going to be.
Yes.
Is the hope that you will be able to reach remission
Hmm.
with those foods too?
Hmm.
Amazing. Absolutely amazing. Well, we're going to have to do a part 2 to find
Yes, for
out.
sure.
So would you recommend the Tolerance Induction Program to other young adults?
Yes, absolutely. I think no matter if you're a younger patient or an older patient, I would totally recommend it. I think that's a question I get asked often is like, do I wish I did it sooner? And I just didn't know about it sooner. So I think if you're just finding out and you're an older patient, then it's a great option to explore.
Yeah. And if you're an adult and you're afraid of having these allergens in your house after being told for your entire life not to have it in your house, what do you say to those people?
I think one thing that has really helped me is therapy. I think not just with treatment, but all things related to food allergy life, even just after a reaction, being able to kind of talk to someone about that. I mean, my parents are so supportive and so helpful and great to talk to too, but I think therapy has been a really great thing for me and then especially going through treatment and kind of having this added stress on my life. It's great to have that as well.
I completely agree.
Mhm.
I completely agree. So how can we follow you and find more about your story? Because I understand you're very active on social media.
Yes.
So tell us about your social media.
Yes, so I share my life with food allergies online, and it's Sarah and Spices on mainly Instagram and TikTok.
Nice. Nice. Sarah and Spices on Instagram and TikTok.
Hmm.
So you live your life with food allergies, and everyone knows that you can't have these X amount of allergens and stay clear, and you're the food allergy person.
Hmm.
And now you're on the other side of this and you can freely eat. What are some of the things that were said to you or perceptions of like, wait, now you're okay?
Hmm.
What that must be a thing, right? Like people must be like, I don't believe you, or I don't get, or were you
Hmm.
faking it before? Tell me a bit about that.
Yeah, that's actually an interesting question. I think, especially with my peanut allergy throughout college, I got a lot of pushback because it wasn't safe for me to be around peanuts. So no one was allowed to eat peanuts in any of my classrooms.
Mm.
And it was kind of awful. I would sit in the class and the professor would make the announcement, and then I
Ugh.
would just hear everyone like say things about me right in front of my face. It was very awkward. But once I started sharing my allergy treatment online and now I'm able to eat peanuts, there's this one comment that really like stood out to me, and it was something along the lines of like, "Wow, you were faking this the whole time and we could have eaten peanuts around you in class." And I was
Whoa.
just like, well, obviously no, I went through allergy treatment.
Yeah.
But it was interesting just to see like other people's reactions to it, because you would think that people would be like, wow, this is so cool that you can now eat them and be around them, because that's how I felt, it's how my family and friends felt. But it was just interesting seeing like the public's view of it almost.
Yeah. What made you go on social media and really expose and document your life
Mhm.
through this? What made you decide to do that?
Yeah, like as I was mentioning being bullied, I really felt like alone with my food allergies.
Mm.
And growing up, I really didn't have friends or, classmates that also had food allergies. So I didn't have that person to relate to. So I really just share my life online now so that no one feels as alone as I once did. And in return, honestly, it's made me feel like I have this community of really supportive people that get it as I navigate, life in my 20s and beyond college. It's been really nice to also have that support as well.
How was Halloween for you
It
this
was
year?
very fun.
Yeah.
I hosted a party.
Yeah, you did. Peanut party, Reese's.
I wish. I'm trying to think what we did. I made a cake. I made so many things. Yeah.
Good for you.
Mhm.
Was that growing up really hard Halloween, or was it just all you knew?
It's all I knew. Yeah. I think also my parents were really amazing growing up. They made holidays feel, very normal and inclusive with food allergies. So,
Of course they did.
mhm.
Do you have other members of your family who have food allergies?
Mhm. Yeah, so one of my sisters does, my mom, and then also my grandma did.
Wow.
Mhm.
Okay, so there's a legacy here.
Mhm.
Wow. Are they interested in the program?
Oddly enough, no. My sister, but she's really busy right now. She just graduated with her master's, so she's, new in her career and really focusing on that. And it is interesting. I talk to a lot of adults with food allergies, and a lot of them decide that, they're not interested in treatment, and that's totally fine. I think sometimes when you live with food allergies your whole life, and if they're not, it might be fine to not go through treatment if you feel really comfortable going through the day to day with it. I just always say that like it's a great option to explore, but it might not be right for everyone.
I think you're very resilient.
Thank
I
you.
think you are the perfect guest for this podcast. You have faced really hard times. You have come out the other end. You have been bent, but you did not break.
Mhm.
And you now have a platform where you're trying to help other people and make people feel not alone in this. And I think that is amazing and
Thank you.
awesome. So thank you.
Mhm.
Well, thank you so much for joining us today. Thank you
Thank-
for sharing your story. And you
Mhm.
are so brave. And we will continue to watch you.
Sounds great. Thanks for having me.
Of course. And thank you, the listener, for joining us today on this episode of Resilience and Hope, a Food Allergy podcast. We have an email address and we want to hear from you. Please write us. Our email is resilienceandhopepodcast@gmail.com. If you have any questions, comments, ideas for future episodes. We also have social media, so please follow us at Resilience and Hope Podcast. And until next time, I'm Lesley-Anne Stone. Resilience and Hope podcast is made possible thanks to the support of the Food Allergy Institute.